Hi everyone, I'm Joyce the Dentist, and today I want to talk to you about one of the most serious oral health conditions I see in my office. No, I'm not talking about cavities, I'm talking about gum recession. Your gums, or what we call gingiva, play some very important roles when it comes to your oral health. They provide both a protective barrier as well as stability for the supporting bone that wraps around the roots of your teeth. In a perfectly healthy mouth, your gingiva come up to the part of your tooth that we call the cemento-enamel junction, or the CEJ. Your CEJ is basically the neck of your tooth, where the crown tapers off and your visible root starts. Sometimes we see situations where those gums begin to recede or pull back from your CEJ, and that exposes some of your root surface. We call this condition gum recession. Over the years, some people have mistakenly referred to it as being long in the tooth to indicate older age. Why is gum recession a big deal? There are a handful of reasons. One is that the root surfaces don't have a protective defense layer of enamel around them. So once they're exposed, you're at a higher risk of developing root surface cavities or sensitivity. Second is that when your gums recede, it can also indicate that you've lost bone in that area. The further down your gums are, the more bone you've lost, which will ultimately equate to loose teeth or even teeth falling out. The good news is that in most cases, gum recession is preventable. And to prevent it, we have to understand what is causing the gums to pull back. But surprise, surprise, it's not your age. One of the reasons your gums will recede is periodontal disease, also called gum disease. Periodontitis is where the gums get infected and start to pull away from your teeth. As this happens, it creates these pockets under your gums where more bacteria can hang out and start this cycle of infection. Symptoms usually include red, swollen, or bleeding gums, as well as bad breath and visible tartar buildup. The first place you'll notice gums receding will probably be in the papilla, which is the pointed little area of gum tissue between each of your teeth. The second reason people's gums recede is because they're scrubbing their teeth too hard with a toothbrush. Yes, it's possible to brush too hard, and remember to always use an extra soft bristled toothbrush. Scrub brushing can wear away your tooth enamel over time, creating notches in your teeth. Scrubbing can wear away your tooth enamel over time, creating softened indentations in the roots of your teeth. So you can just guess what it does for your gums. Over time, all of that overzealous toothbrushing can leave your teeth really clean, but it also traumatizes your gum tissues and makes them pull back away from the crown of your tooth. The third reason people might see receding gums is because of severe tooth misalignment or rapid tooth movement. Whenever your teeth are really out of alignment, it puts strain on the gingival tissues around them. That's why if you have one tooth that's jutted out more than the others, there's a pretty good chance that the gums over it will start pulling back, just because of the tension that's created. Similarly, if teeth are moved too quickly during orthodontic treatment, it can traumatize the bone and gum tissues around your teeth. That's why you never want to take the approach of rapidly moving your teeth faster than your dental provider recommends. At this point, you're probably wondering, will my gums ever grow back? And I've got some bad news. No. They do not. Like bone loss around your tooth roots or cavities in your teeth, gum recession is one of those things that isn't reversible. That's why you want to identify the cause and intervene as early as possible. The good news is that there are treatments out there for gum recession. You've got around 3 options, with the last one being the most significant. Number 1, if you have gum disease, talk to your dentist about periodontal therapy. This will target the bacteria causing your gum recession to keep it from getting worse. Number 2, consider getting orthodontic aligners or braces to move your teeth into a healthier position. This will reduce the stretching and pulling on your gums if that's causing the issue. Plus, it lowers your risk of other oral health complications associated with crooked teeth. Number 3, your dentist or periodontist can perform gingival augmentation, or what we call a gum graft, whether it is mild to moderate to more severe recession. This is where we move a piece of gum tissue over the exposed area and suture it into place so that it fuses with the existing tissues to restore that nice, healthy gum line. Gum grafts serve both a functional as well as aesthetic purpose. There's also modified gum treatment that some dentists offer, which is a specialized procedure called pinhole rejuvenation. With pinhole treatment, instead of placing grafting tissue, you're basically stretching the existing gums up over the tooth like you would pull a blanket over yourself. Bottom line is, if you notice that your gums are starting to recede or your dentist brings it up during your exam, you'll want to keep a close eye on it and make any modifications before things get worse. Remember, staying ahead of gingival recession is one of the best things that you can do for your smile's future. Smile smart, everyone. I'm Dr. Joyce. I'll see you next time. Bye.